With arthritis, you have a loss of articular cartilage and you have bone rubbing up on bone. When you talk about the shoulder, there are actually two different joints in the shoulder. You have your acromioclavicular joint, or AC joint, and you have your ball and socket joint, or glenohumeral joint. Treatment of arthritis for your AC joint is reserved two options, essentially non-operative treatment and operative treatment. Non-operative treatment for AC joint arthritis typically is anti-inflammatory medications and cortisone injections. For the subset of patients where non-operative treatment is not successful, then surgical management is indicated. The surgical treatment for this joint is a distal clavicle excision. I typically do this arthroscopically, so I stick a camera into the shoulder joint. I directly visualize the acromioclavicular joint, and I remove the distal part of the clavicle so there is no longer bone rubbing up against bone. The recovery process is actually very quick. I'm able to get patients back to doing activities that they like to do in 6 to 8 weeks. The primary treatment for shoulder osteoarthritis of the glenohumeral joint is non-operative, and it involves the same things as the AC joint. Now, there are different types of treatments surgically for this, depending upon the age of the patient and how advanced the arthritis is. Typically, it involves replacement of a part of the shoulder joint. We can do a partial replacement where we replace the ball. We can do a full, what we call anatomic total shoulder arthroplasty, where we replace the ball and the socket. And in patients who have a special type of arthritis called rotator cuff arthropathy, where they have arthritis from a deficient rotator cuff, we do what's called a reverse total shoulder arthroplasty. It's called a reverse arthroplasty because we put the ball where the socket normally goes and the socket where the ball normally goes. The recovery for shoulder arthroplasty is a little bit longer than most placements compared to elsewhere in the body. 3 to 6 months of formal physical therapy, and they do not get a complete recovery until actually about a year after their surgery. Patients get real good pain relief from it. It's long lasting.